So ladies and gentlemen, without taking much time, I'm going to request each of us just to mention your name, your organization, and perhaps if there's anything else you want to mention in 2 seconds, maybe your expectation, we'll be happy to hear that.
I've been working with Henry for quite some time on a number of policy forums, which provide an opportunity for people to really discuss critical issues facing this wonderful city of yours. So I hope we have a discussion that will also lead hopefully to future collaborations and a proper air monitoring system for the city.
Without taking much time, ladies and gentlemen, I think my work today is very simple, just to facilitate the program. And just to make sure that we all understand our discussion, is that the theme of our discussion today is that the state of air quality in Nairobi City, air quality trends, health, and social impacts. So those are some of the areas that we're going to be listening to in terms of presentation. I think it's now my pleasure to invite Professor Gitari just to take us through a scientific presentation of the current state of air quality in the city.
Air quality is all about health. And I'll try now to, some of us who understand the detailed science, and as we shall try to have a general view of it. So all we are talking about is all about your breathing system and what gets into your breathing system. And we talk of the particles which are floating in the air and the gas. They all go in, but certainly at a limited space. 10 micrometers will definitely go in. They won't go in all the way, but when you go to 2.5 micrometers, they will definitely go and interfere with where oxygen and carbon dioxide is exchanged in the blood system. This vehicle is stationary, and the engine is on, and there is some emissions there, so even when you are walking around. And now with that, you can imagine the number of people who are jogging in Nairobi, because trying to be healthy when you are jogging along the streets of Langata, I doubt you are trying to be healthy.
I think that was a good presentation, and the message I'm taking from that is that none of us is safe. Whether you are driving, whether you are cycling, whether you are jogging, whether you are in the office, none of us is safe from the negative impact of the air quality that we have in Nairobi.
Clean air is a basic right, and there's something that we should all guard with a lot of jealousy, if I can call it, because we cannot package it and put it in for our personal use. Whatever happens to the air, we have to breathe it. There has been growing evidence that shows that air, mostly urban air, but also in the rural areas, indoor air, is a major source of heart and lung disease. We have cancers that are coming up, and even for the unborn, we have low birth weight, which sets them up for a future full of challenges with health. And in 2012, the WHO has estimated that 7 million premature deaths were caused by air pollution alone. And when we come home closer to our settings, in the Nairobi slums, APHRC has done some work on the burden of disease, and we found that there's a lot of pneumonia cases, deaths due to pneumonia, and we are attributing that to air pollution, because in the houses, if you have been to the slum, a typical house is very small, and they concentrate quite high volumes of pollutants because they are using any form of fuels that they can find. And we chose the study sites of Korogosho and Viwandani because we had an ongoing surveillance of the population there, so it gave us a very good sampling frame for our work. And someone has asked us whether the slums are really representative of our city. But I think in Africa, slums are going to be very representative of our city because 6 out of 10 people live there. Then can we enforce regulations? If I see a vehicle belching that black smoke, I always wonder, isn't there a police officer who is noticing that he's also going to die from inhaling this thing? Why not stop them and tell them, please, if you don't get your act together, you cannot be on the road? Let's be strict. I think we have to just say, this air, if it disappears, then we are all gone.
I think she's given us a picture of how it is in the slum areas in terms of the air quality and what people down there are going through. which is basically more or less a reflection of what the entire city looks like when it comes to issue of air quality. And we maybe just have maybe one or two response to the presentation that we've had, maybe a question or a comment or some kind of reaction, so that can give Mr. Mwai time to come up with this presentation.
All this data that you've been carrying out, you can act on it, or you just study and then you keep it, and then when you come and present it, all of us are shocked at what we are seeing.
The culture we have is that I'll tell you, even when we have seminars like this, we invite senior government officers to come and attend. They opt to send their juniors.
We say it's 2.05 particles per cubic or per unit of air. What is the World Health Organization recommended level, so that I can put it in my mind, classify it? And is it good? Is it bad? Where does Nairobi sit? And also, where does Nairobi sit in compared to other African cities and maybe developed economies and so on?
Quality is bad, as Michael knows it. He's doing a very good job, but he has, he's doing this sometimes. He don't have the capacity to do this measurement all the year around at every places in the village. So he can't tell that which places in the village is it was. That is a problem. How is this changing? When you change things in the city, how is this quality changing?
Yeah, maybe also you are looking, if I told you that Nairobi is not qualified as a mega city, because we are talking of 10 million people in Mexico, in Cairo. The air quality in Nairobi is comparable and sometimes worse than in Cairo and Mexico, where there have been major studies.
As per the economic survey of 2012, it indicates that out of 39 million cases of reported morbidity in Kenya, about 12 million cases were due to respiratory tract infections. We are saying it is due to industrial processes, energy sector, transport sector, and waste disposal systems. The other thing we are finding in our cities that I don't think the people of the middle card, whether they're in this area, is the issue of we have turned our bus stops into bus parks.
So thank you very much, Mr. Mwai, for that presentation. So we want to try and move very fast so that we can catch up with time. And so we have our other guest who had not arrived, Mr. Evans Ondieki, who has just come in. Evans Ondieki is the County Executive Committee member in charge of environmental issues at the county government.
When it comes to air quality, and we have the worst air quality at the moment, although we are the best city, we are the best city in the sense that the climate here is cool, the people are good, the food is good, we are dealing with the security situation. You've never seen Ebola here. So this is a relatively safe city. It's actually one of the best cities in the world. But the problem we have is that we take good things for granted. Until it is too late, until damage is done, is when you realize, oh my dear, oh my God, this was gold. Let me deal with enforcement. What is our policy on enforcement? Do we have enforcement? Look at traffic police. They are just cheating you. They are on mobile and they are busy telling vehicles to move. If the traffic lights are working, why don't we give technology a chance?
Thank you very much, Bwana Waziri, for those remarks. Let me go straight to the next session. Yeah, we are going to the next session, which is now the interactive session, a question or a comment.
You do not need a procurement officer to put money into the university to train a few professionals to help you in water management, in air quality, and all this. And once you have a critical mass within the Nairobi County, you are going to move.
What is it that you're doing to these people who are burning garbage at the back of their compounds?
You mentioned about knowing that people are adulterating fuels with kerosene, and I'm just wondering whether we have who between you, NEMA, and KEBS, Kenya Bureau of Standards, is in charge of checking the quality of fuels that are ending up in the vehicles.
When it comes to the issue of the question from the media is that I did talk about bus park. What I said, I talked about bus stops having been turned into bus park. A case in point is at a place like Road Ambassador. You have got our brothers and sisters who are working in those shops which have been turned into small stores, which have got no ventilation, and so they have challenges of occupational air quality in those stores. By evening, they are complaining of having severe headaches. The issue of adulteration. I want to assure my colleague from Africa Population Health Services that this assessment so that a very small percentage of the branded petrol stations and the fuels. So as long as you're on the branded petrol stations, the percentage was very small, maybe 1 or 2. But that activity is normally conducted by the ERC and the Kenya Bureau.
We can collaborate with the University of Nairobi to develop a biodegradable bag because the current one is too costly. Now, burning of garbage in compounds, not just compounds, because I don't think that burning of garbage in the compound causes a lot of pollution. The really burning of garbage is in the dumping sites like Dandora, the one that causes a lot of damage to the environment. The other component is the burning of tires, which are actually criminal acts. That one we can deal with if we have proper enforcement. Enforcement, yes. Let me finish my phrase. Enforcement begins with you. Yes. Enforcement begins with you. Let us be honest. If you have a tire, the poor person who burns the tire does not own tires. You have a tire at home which you don't want to use. Why do you throw it into the road? Gutter it and call it the Nairobi County government. Yeah, let me tell you the formula of responsible attitude of responsible citizens. Gutter all those unused tires. Call us, we come and pick them, and we go and dispose them responsibly. Yes. But when you go them and throw them on the road, the people who want copper wire will take them and burn them anyhow. The number to call. Now, let me tell you, the number to call, you can access us through the normal website or through my own number. You can call my number, 0724 942 345. If you call that number, you will get a vehicle within 30 minutes. I act.
You have
Yes.
told this small group now.
Yes.
But what I think we need plans
Yes.
for how this gets communicated to larger audiences. Because this is a very small group. We're hearing something we never heard before. And now we would be happy to move on it. But what's the plan of the city for making known that this kind of flyers and other dangerous goods could be collected?
Professor, that's why we are here. We are here to share good practice. We're here to tell each other the truth.
You said that there was data available, but we see that we don't really see that there is air quality data. And one very good way of doing public awareness in many other cities, like Göteborg, where I'm from, is that there is a monitoring going on, air quality monitoring, and it's on the internet. So everybody can see it, even on their iPhone, what's the air quality today. Is that data available? Because I have not been able to see that.
And I agree with you that when I made my presentation, one of the challenges I see is that there is no proper data existing.
And actually, that's one of the reasons why we are from Göteborg here, is to figure out what kind of collaboration can be done in terms of helping out with monitoring on the long term, capacity building on long term monitoring.
The technocrats in the office have been major beneficiaries of the inefficiency and incompetence in the system. They benefit either indirectly or directly. And therefore, there is no reason to release this, because if they release, then they lose the privileges they have been enjoying. So part of it is because of self-interest.
So, ladies and gentlemen, I want us to come to the close of this session. And we have a few closing remarks from our other partners which I'll ask them to do in very few minutes.
In Kenya, we have this culture of consumption. If you look at most of us, we like driving big cars, which are powered by diesel, and diesel is a major polluter. So if you think about a bigger economy in Kenya with our current culture, then we have a worse situation on air quality. The other thing I would like to mention, historically, before the British came to Kenya, I think the population of Kenya was around 3 to 4 million. When they left Kenya, we were around 9 million. Today, we are 42 million. So thinking of 42 million people with a culture of consumption, a growing economy, you paint that picture of air quality.
Now, I want to say that people have a perception, especially that there's a lot of data because there's many reports, many consultants giving reports. But let me tell you, I'm a proud member of the Digital Matatu team that developed transit data for the city and one of the first public transit maps. With the billions coming into transit, no one thought to develop transit data for the existing system, make it open, make it free. So what happens with the consultants' reports, we don't know what kind of data they use, we don't know what their methodology, it's not shared. So you have the perception that there's a lot of data, it doesn't exist. Now coming back to the air quality point, we do have some data heroically done by scientists like Dr. Gitari, minimal resources at the University of Nairobi, dedicated graduate students, poor equipment, working with important international collaborators who try to help the system so that there can be a way to do regular data collection. That does not exist right now. You can't monitor over time what your air is like, whether it gets worse, whether it gets better, we don't know. So we need a system, and the university has to be part of that system. Your own scientists, technical experts, many who are willing to even dip into their own pockets to sometimes, like Dr. Gitari has done, to make sure there's some basic data available. That needs to change. I'm encouraging you to support us in this effort. Contact us. We have an open invitation to the county and to NEMA to work with us on this. And with that, I'm going to say thank you so much. Let's continue this conversation, not just over tea, but into the future. So thank you so much for being here.
Thank you, Jackie, for those remarks. We have come to the end of this session, so might just to invite you for a cup of tea and coffee and some refreshment.
Once we give people information, you've given them a tool that they can use to fight for their rights. Once we inform citizens that the air we are breathing is not so good, then it makes them look into themselves and see, where am I going wrong? What am I doing? Is my neighbor also doing the same thing? Can we sit down and talk?
When it comes to air quality, all of us have a role to play. We have a responsibility, and we must be able to take it up. I think there's the part of the government in terms of enforcement, but also there's the part of the citizens and the other stakeholders in terms of providing data, and in terms of taking up their roles and responsibility of being responsible citizens and making sure that they have proper values and proper attitudes when dealing with their day-to-day lives.
One thing that came out of the meeting, but not explicitly, is that many of the poor in Nairobi are the worst affected. They do not own vehicles, but vehicles are one of the major sources of pollutants. They often have to walk, and some of the air in the places they walk is very bad. Mr. Mwai from NEMA mentioned that they have a triple burden because they have air pollution when they're walking, air pollution at work, and air pollution when they come home because they burn kerosene, charcoal in enclosed spaces and poor housing.
It would be important for Kara probably to think of how they can have seminars which are visited by a larger group of the poor people, like in halls, in public halls, not in big hotels like this, but in public halls where those poor people can be requested to come and listen to, so that they can be able to claim their rights, especially in terms of air quality.